Hi, I'm Steve Adubato. Once again, a very compelling, important conversation about COVID, about the vaccine situation. So many questions, trying to find the correct answers, and we're honored to be joined by Dr. Joshua Coren, Chair and Professor, Department of Family Medicine, Rowan University School of Osteopathic Medicine. Good to have you with us, Doctor.
Thanks so much, Steve. Good morning to you.
Doctor, first, to describe your role down at Rowan, which is one of the higher ed institutions we collaborate with.
Sure. I'm a chair and professor of family medicine within the school, so I teach medical students. I also see patients there. Most recently, I've been working on a lot of our clinical affairs roles as interim associate dean for clinical affairs as well.
Doctor, what is the role of a university, in this case Rowan, as it relates to vaccine distribution, particularly in the southern part of New Jersey?
So that's a great question, Steve. So we've been really fortunate. We have a large facility, and since last March, it's been underutilized because our students have been doing a lot more remote learning. So we knew we had the facility space, and we also knew we had a lot of large teams, medical students, faculty, and staff that had both the professional knowledge and the willingness to try to help people out. So we had both ingredients, and we went back to the Department of Health and said we're ready to help out with vaccinating the South Jersey area.
We are taping on February 16th. You'll see a couple of websites up. And I know people are frustrated by the websites. I know it's sometimes hard to navigate. Then there's a telephone number, which is potentially harder to navigate. We're going to put up our team, our great team behind the scenes, puts up the CDC website, followed by the State Department of Health COVID website. Let me ask you this: on February 16th, as we tape, this will be seen March and beyond. What are the greatest challenges you and your colleagues face down at Rowan as it relates to vaccine supply/distribution?
Yeah, so I think the supply right now is a challenge for New Jersey at large. They've been really only getting about 100,000 doses per week. We're receiving only about 1,500 doses per week. That's 300 doses per day for the 5-day work week. So we really can do a lot more than we're getting, but we are
doing— How many, Doctor? I'm sorry for interrupting. How many more than 300? How many more?
We could do about 1,000 a day. So we could do 700 more a day, but we're really only receiving 300. So we unfortunately are using what we have, and the state's giving us what they can provide. Now, I imagine the next couple of weeks we'll start to see that ramp up, but we've been only receiving about 300 a day for the last 4 or 5 weeks.
So to be clear, if there were to be a greater supply, and the Biden administration as we speak right now is promising a much larger number of vaccines than has been made available yet, we'll see what happens. Are you saying that you and your colleagues, as it relates to Rowan and vaccine distribution, could comfortably do 1,000 a day versus 300 a day, which is 3 times the number, correct?
Yeah, 100%. So we're that ready to go hockey team that knows where the puck is, knows how to use all of our sticks. And once we get those shots, we can actually get them in arms.
Doctor, this is an interesting, troubling question. And you're going to see a graphic up on our screen that you may say, hey, why is it up there as you're watching? It's going to be called Confronting Racism. And you're going to ask, what does race or racism, institutional racism, have to do with vaccine distribution? As we tape this program, about 5% of all of the vaccines that have been administered are to people of color, particularly African Americans. A, why? B, what is being done down by you about that?
Sure. So I think that there's been institutional healthcare disparities that have been happening over the course of healthcare within the U.S. For underrepresented minorities, and we know that as an institution as well as within healthcare. Rowan SOM has been all over this. We're doing panel discussions with the School of Medicine is doing panel discussions with our community. We're involving our community within the Rowan Vaccination Center. We're reaching out to those who are underrepresented minorities, and we're really trying to do our best to make sure we get people from underrepresented minorities and vulnerable communities into our site.
But you understand the resistance and frustration based on the history of how the African-American community has been treated by not just the medical community, but by government, by institutions of power. You understand that, right?
I do. And that's why we make sure we have our white leaders, our brown leaders, our Black leaders in front of the population getting vaccinated. It is very important for us as doctors to be there and get vaccinated to show our community of diversity. why it's important right now to make sure that we beat this disease.
Help us on this. There are so many people, and we happen to have 2 teenage boys and a young daughter, and we represent so many other parents out there for whom our kids say, when will we, quote, get back to normal? As I've read with Dr. Fauci and others who have said, listen, that may not be the right question. We may be living with COVID for the foreseeable future and adapting to COVID for the foreseeable future. And after the vaccines, there are these boosters that potentially relate to these variants. You say back to normal or way of life?
Well, I think that there's going to be some back to normal and some way of life with this one. So we're going to have continued vaccinations. We're going to get to some percent that we feel comfortable to function within movie theaters and within restaurants and other locations that have a lot of people, stadiums. I know we miss our baseball games, et cetera. But I think that there's some place to be said that right now we're just not there yet. So until we can get to that 70 to 85% herd immunity, meaning that so many people are vaccinated or have disease that we're protecting each other, we won't be able to. What's that percentage,
doctor? Again, I'm sorry for interrupting. What's the percentage? Is it 60, 70, 80, 90? What is the herd immunity percentage that you see as what our target should be?
So a lot of the details been in that 70 to 85% zone. So I think that's going to continue to get narrowed down, but it looks like it's in that window of 70 to 85% of the population. So fortunately, they're working on, you brought up kids, they're working on vaccine trials right now for children.
And they're probably going to be
AstraZeneca. There's so many different vaccines that are out there. They're each going to start to look at trials. Moderna and Pfizer have clinical trials in pediatrics right now as well. So I think we're going to see that this is going to be the 2021, 2022 next push, which is pediatrics as well.
I want to remind folks we're taping on the 16th of February. Things will change quickly, frankly, hopefully quickly in a better direction in terms of supply and distribution. And most importantly, that expression, shots in the arm, if you will. Dr. Coren, I want to thank you so much. Joshua Coren down at Rowan University, one of our higher ed partners that helps us particularly produce programming around healthcare. Doctor, thank you so much for everything that you and your colleagues are doing.
Steve, thanks so much. Have a great day today.
You too. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the Turrell Fund, supporting Reimagine Childcare, PNC, Grow Up Great, the New Jersey Education Association, the Healthcare Foundation of New Jersey, Atlantic Health System, New Jersey Sharing Network, NJM Insurance Group, and by Fedway Associates, Inc. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Globe.
I was diagnosed with cystic fibrosis when I was 2. It's hard to grow up with CF. But I have an awesome care team at Goryeb Children's Hospital, helping me do the things I want to do, like play lacrosse. And now I've been recruited to play in college.
Where you go for pediatric care matters.
Atlantic Health System, because every moment is a moment that matters.